autism meltdown in a toddler and a young child can often be confused with a tantrum. That confusion stops as the person gets older. And as a person becomes a teenager, meltdowns can get very dangerous. Why? Because the person is bigger and stronger. Just to recap, meltdowns are similar to the fight response. It is a hardwired biological response. Many times there is an underlying health issue which can make someone more susceptible to meltdowns. As time goes by, if these health issues are not addressed, then meltdowns get worse and worse and more intense. That's not a good direction to be going as the person with autism gets stronger and bigger. Many times, this might be when a doctor recommends that your child be put on some type of medication to relax them. There are medications to make someone with autism less irritable and less aggressive. Most parents and the teenager themselves don't want this, but they also don't want the meltdowns. So it becomes a very kind of tender situation. Many times it feels like a lose-lose situation. A meltdown is an intense response to an overwhelming situation. Please keep this in mind that the overwhelming situation might not be overwhelming to anyone else at the time. This loss of control can be expressed verbally by shouting, screaming, crying, physically, kicking, lashing out, biting, or in both ways. In a toddler, this can be handled. However, when the child is physically bigger than the parents or the adult in the situation, this can become very dangerous. Hi, I'm Dr. Teresa Lyons. I teach parents the cutting-edge science of autism so that you can make the best decision for your child based on quality information. Sometimes when a teenager with autism is having a meltdown, the police or fire department might be called. EMTs sometimes respond as well. Sometimes force or restraints are actually used to subdue the person. Some schools have things called situation rooms, which is soundproofed and the walls are lined with foam, and the person can go through the meltdown in a relatively safe environment, have privacy, and obviously skilled people will be there present at all times. Meltdowns in a teenager can be very scary, but not always. Sometimes the person has learned to withdraw themselves from the situation before the meltdown. This is something that can be taught and is a very useful skill to have. And it's great when a person with autism knows their triggers, can communicate when they are starting to experience overload, and it's important that people with autism feel empowered to navigate life and communicate their needs. And their needs to also be respected. Also, people with autism should not be pushed too far in situations when you start to notice some of that initial agitation, because that's when meltdowns happen. Please check out my channel because I have other videos that talk about the 6 stages of an autism meltdown, how long an autism meltdown can last, how to manage meltdowns, and so much more. If you found this video to be helpful, please hit the like button and also subscribe to my channel to get the cutting-edge scientific information about autism so that you can make the best decisions for your child based on quality information.